Illinois. Good afternoon, ma'am.
Thank you for having me, Martin.
It's a pleasure. I am not one to absolve the administration of fault, yet when I look at these numbers, there is really only one conclusion. Where Republican obstructionism is at its strongest, the healthcare rollout is having its biggest problems. That's correct, isn't it?
Well, that's certainly true that in the states that have not expanded Medicaid, for example, the enrollments are down because people can't get into the program. And this relentless 3.5-year campaign nonstop against enrollment in Obamacare, particularly focused in areas where, the Tea Party is strong and the opposition is great. Is it any surprise that people are reluctant to sign up? But the other thing, Martin, is we know that there's interest, and we saw it with the people that tried to go to the website. And as soon as healthcare.gov, and it's getting better every day, gets better, those numbers, I think, will embarrass the Republicans.
Okay. Well, a former president has made an intervention today on the White House promise that if you like your plan, you can keep it. I'd like you to take a listen.
I personally believe, even if it takes a change in the law, the president should honor the commitment the federal government made to those people and let them keep what they got.
Now, I imagine, ma'am, that the White House will not be best pleased with that answer. But isn't the whole point of this reform to ensure a minimum standard that all insurers will be required to provide? You know, of course, we can all go back to a system where contraception was not included, where women couldn't receive mammograms, where mental health was not covered at all. But is that really preferable? And is that what the Republicans are saying? Let's go back to that.
Well, 2 points, Martin. The number one cause of personal bankruptcies in our country has been health care costs. And most of those people were insured, or at least they thought they were insured, and found out when they got sick or they needed their insurance that it really wasn't there for them. And the second point is, insurance companies will not be required to give everyone the policy that they had. They'll be able, as they have in the past, been able to pick and choose. So if you've had a policy and you're sick, they don't have to offer you that policy again. They can go after the healthy people and say, oh, yes, you're welcome to stay insured in this plan that doesn't cover the 10 essential health benefits that are now required under Obamacare.
Yeah. Let's shift, if we can, to tomorrow's bipartisan budget conference, or, as you know, what Republicans like to call another opportunity to shut down the government. One might be tempted to believe that, given all of the polling and the condemnation of Republicans, there might actually be some hope of achieving a budget compromise this time around. Or is that simply wishful thinking?
Well, they have to say that there will be a balanced approach, and that means that the Republicans have to be willing to put revenue on the table. You know, Martin, this country has never been richer. If you look at per capita GDP, it doesn't feel that way when you hear about austerity and we have to cut this and we have to cut that. It's because the income inequality is greater than it has ever been. And so in order to really provide for what we need, the Republicans are going to have to say that revenue is going to be a part of that. The Democrats have always been willing to look at trimming budgets in ways that don't really hurt people. And our number one priority is to get rid of the sequester, to replace it with an honest budget that doesn't do this meat axe approach that is hurting so many people, so many children and seniors and low-income people and even middle-income people. It's not a good plan. So that's what Patty Murray has said. Let's eliminate the sequester and let's have a balanced way to replace the budget.
Let's hope that there's some progress on that. Representative Jan Schakowsky,
Hope so.
as ever, thank you so much for joining us.
Thank you, Martin.
Coming up, the day's